Yeah, I think there's a few ways to integrate new data sets into community oncology. The first one is a lot of community oncologists, at least in the United States, follow pathways. I sit on one of those pathway committees for US Oncology, where we take all the new data, we look at the NCCN guidelines, we look at ASCO guidelines, and we make our own decisions on how best we should be treating our patients within our network. But it's more important than that. It's not just following pathways and understanding what the most new treatments are. It's also being able to understand the nuances in the data sets. I think podcasts have been incredibly helpful for community oncologists, driving to work or commuting to work on trains or subways and listening to somebody that they're familiar with break down the new data into action items for their practice. I think they've been critical. I think there's certain websites as well that help disseminate education and information. But I think we're in a shifting landscape where we're using podcasts and newer ways of information transfer. Yeah, I think the most important thing is technology is speeding up so quickly with artificial intelligence that our decision making with data is going to get easier, I think, in the next 5 to 10 years. And that's when those soft factors about being an oncologist come into play. How do we treat our patients in clinic? How do we speak to our patients? How do we navigate understanding the data to give the right dose for the right patient and navigating the side effects? So I would say focusing on the Kaplan-Meier curves and the p-values and the hazard ratios, that's all important for your education. But what's probably going to be more important for the next decade or two of your clinical practice is understanding how to navigate the side effects of the therapies, really get to know those, and understand how age impacts side effects, understand how ethnicities may impact side effects, understand all those other things that are incredibly important for the care of the patient, because I think that's going to be where we really need to fill the void that artificial intelligence and technology won't fill for us. Yeah, I think patients are excited, actually, to go from traditional chemotherapy or traditional chemotherapy with immune therapy to a more targeted chemotherapy delivery system through an antibody drug conjugate. They're very excited when you describe the mechanism of action. There's a couple of complications, such as cost is different and these things that the healthcare systems around the world are feeling with the transition to giving more enfortumab vedotin in urothelial carcinoma. The other thing, though, is the side effects profiles are different. We have to be more cautious about neuropathy. We have to be more cautious about skin side effects. So talking to patients, and actually I give them homework. I say, if you're having a rash, you need to call right away. These are the things to look for, because that's how we stay out of trouble with those grade 3 and grade 4 dermatologic events. When it comes to neuropathy, it's an open and honest conversation with your patients so that they are telling you before you go too far. All too often, I've seen patients in other clinics referred to me for secondary care that are having trouble walking now or in a wheelchair because of neuropathy from those drugs. So I think it's understanding the side effects. It's counseling patients better, because what they're going into your clinic thinking about, traditional chemotherapy, is probably not what they're going to actually get, at least where I practice.